So thank you very much. There's a background to the story, and I think it's also very good that we um, put it in proper perspective. On Tuesday, the National Assembly, that's the House Committee on Health Institution, led by Honorable Amos Magaji, they came here for oversight function. So that is a constitutional responsibility. We are funded by taxpayers' money, and the constitution allows them to come and see what we have used the money has been budgeted for, and they do that often. So they came, and we took them around. They also met the members of the LUTH community, all HODs, members of the union, both junior and senior. So we had interaction with them, and we took them around. And really, they were impressed with the level of infrastructural renewal here. And we made them to understand that this actually really started some 4 or 5 years ago, and also the continuation by this present government. Because one of the reasons that people give for wanting to leave the country and go out, one of them is actually infrastructure. So, and government has done a lot. A lot still need to be done. But LUTH of 2015 is not LUTH of 2023. So they saw it, we took them around. We have the independent power supply in LUTH. We have 24/7 electricity since 2017. I know that comes with a heavy cost. So no doubt, we needed to let them know so that we can be of help regarding that. We also show them our cancer center, which happened to be the best cancer center in terms of facility-wise in sub-Saharan Africa. We have the intensive care unit, 30 bed. That's the single largest facility like that in West Africa. They also went to go and see some of our wards that we have renovated, and also many Nigerians are also coming in to help us. They also saw some of the facilities like Alima Oncology Ward, donated by a kind-hearted Nigerian, a woman. So for 60 beds, fully sponsored by her from the scratch. So, and also furnished. We also show them Lionel Soladada dialysis center. So, and there's so many of the facilities around. So, and of course, they also wanted to know, because the reason why they've come is to look at our progress. And when you're talking about progress, you're talking about something positive and also things negative. What are the challenges? They are aware. Particularly, they know, of course, where they were interacting with the staff and the union. The one on the front burner was actually the number of staff available because of this jack passenger. So, and in an attempt to now told them, how many staff do you have? The doctor, the nurses, the pharmacists. What about how is that affecting you? So they got to know that we have 45 wards in total at about almost 1,000 beds. So particularly 2 or 3 or 4 that we use government money to put into shape, renovated. We are not able to go back to those wards because every time I speak with the nurses, we don't have enough. So although I'm aware where government is making effort to get more people into the system, but the reality is that that's what they saw. And when they addressed the press, they spoke about some of the positive, and they needed to also mention, and I think for me, it was good, so that at least the executive and the legislature, the process of new budget is on. So they were so enthusiastic, they actually came with the mind to help. So we needed to let them know. And they said they are aware they're going to pass. So when they are giving the press conference, they mention many of those things they have seen. They've also mentioned the challenges of it. But unfortunately, the press picked that, and they made a story out of it. But it is what it is. So, but the question is that's actually the background regarding the story. We can't underestimate or underrate the reality. However, we must also not blow it out of proportion so that I don't scare people. Virtually all our wards are general wards because of challenges that we have. We can admit to any ward, any, except pediatrics. And pediatrics too, you have male and female, you can admit them there. So, and also put it in perspective, the news that came out, 5 ward, 150. There are so many hospitals in Nigeria that their bed occupancy is 100. So if anybody has not been exposed to a big hospital like ours, 150. That's why I put it in perspective. We have 45 wards. We have challenging with 5. The video I sent to you, I don't know whether you watched it, when I was responding on TVC yesterday. Because that was not in the original picture. I needed to, so that people do not need to panic. We have 45 wards spread across the entire hospital. We have challenges with 5, which we are making effort with government to fill. However, we have 40 wards functioning. Our capacity is 960. So we still have over 800 beds. But really, not enough, but it's not as bad as, that's the reason why I needed to put it in perspective. Those 5 that we are talking about too, I told you that some of them are under renovation. And also a recruitment process is on that I've sat down with the director of nursing. As we recruit, open this ward. This ward, unfortunately, what went out is shut down. We didn't really shut down. Let me give you the real story. Government gave us money for infrastructural renewal. I'm going to show you some of the ward. To renovate the wards. What did he do? We need to move the ward and match with other wards. When we were done with the renovation, to go back became a problem. It's not really shut down, really. But the only way to explain is that, now to go back, what's happening? We don't have enough nurses. It's not that patients we can't say that patients are not suffering, but we can also say that they are really suffering because we moved them to match them. Now, for example, you are working on a ward E6. You need to move patients from ward E6 to ward E5 that we are not renovating. You match their nurses. By the time you are done 1 year after or 6 months after, the number of nurses that are there coping with that number, they've reduced. So even if you want to move back, you don't have enough. That's exactly what happened. It's not that we didn't lock any, no. Many of these ones that we are not, is either the undergoing renovation or those ones that we don't have enough complement to return them back. We couldn't have. It's not possible to say, okay, everybody leave. No, it's not.